Day reading mitigation. This is 𝐂𝐚𝐬𝐬𝐢𝐬𝐬𝐢𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬 Okay, the material that we're going to discuss today is typhoid fever. The material that we're going to discuss today is typhoid fever. Okay, this was published earlier today via our Facebook as well as our Telegram channel. So those who haven't gone through it or were not able to see it, the material will be popping up on the screen soon. Check for it for 2 minutes. All right. So I hope everybody was able to go through the material. Let's just go through the material briefly. We'll go deep into it. As in briefly, we'll go into it, and as we discussed, all the text A, B, C, and D. So എല്ലാവർക്കും എല്ലാ തവണയും ഞാൻ പറയുന്ന പോലെ പാർട്ട് എയിൽ ഇറ്റ് ഇസ് ഡിവൈഡ് ഇൻറ്റു 4 ടെക്സ്റ്റ് A, B, C, and D. So let's go through it. Text A എന്താ പറയുന്നത്? As usual, text A will always be the intro to the material. എന്ത് മെറ്റീരിയൽ ആണോ, whatever the material is, text A is an intro to the same. So let's see what text A is. Typhoid fever is a bacterial infection that can spread throughout the body, affecting many organs. Without prompt treatment, it can cause serious complications and can be fatal. So, what is typhoid fever? എന്താണ് typhoid fever? And first definition ആണ് നമുക്ക് first line തന്നെ, that the initial small paragraph, that അതിൽ first line തന്നെ പറയുന്നത് എന്താ? It is a bacterial infection and which can spread throughout the body and it affects many organs. It's caused by Salmonella typhi, which is related to the bacteria that can cause Salmonella food poisoning. So, food poisoning cause the bacteria, or related bacteria is the one that causes typhoid. That is Salmonella typhi. Typhoid fever is highly contagious. An infected person can pass the bacteria out of their body in their poo or less commonly in their pee. If someone else eats food or drinks water that's been contaminated with small amount of infected poo or pee, they can become infected with the bacteria and can develop typhoid fever. So, what is a mode of contamination? An infected person can pass bacteria out of their body through their poo or less commonly pee. And if another person drinks or eats food or drinks water that has been contaminated with the same, the bacteria, the person who is eating the contaminated one can get infected by the Salmonella typhi and develop typhoid fever. Typhoid fever is most common in parts of the world with poor sanitation and limited access to clean water. Everywhere it is very common. Where can you find this disease? That is typhoid fever, and the disease very common in parts of the world with poor sanitation and limited access to clean water. Clean water and poor sanitation areas parts of the world where the sanitation is poor and the access to clean water is limited. Typhoid fever is very common. Yes. Good evening, Shiny. Yes. Worldwide, children are thought to be the most at risk of developing typhoid fever. So, who are thought worldwide as in at greater risk? Greater risk around the world is being thought as children. Why children? This may be because their immune system is still developing. So, unlike the adults, the child's immune system is still developing. Children are more prone to get the infection. However, children with typhoid fever tend to have milder symptoms than adults. Typhoid fever is uncommon in UK with around 300 infections confirmed yearly. So, even though we said the immune system is still developing in the typhoid fever in a child or in children tend to have milder symptoms compared to adults. Adults appear the symptoms, child typhoid fever symptoms are mild. And it is very uncommon in UK. Typhoid fever is not a common disease in the country or in UK with around, and the statistics 300 infections yearly. That's confirmed. So there are parts of the world where there are more than 300 confirmed cases. Okay. The symptoms of typhoid fever usually develop 1 or 2 weeks after the person becomes infected with Salmonella typhi bacteria. So, when are the symptoms being shown? 1 to 2 weeks after the person is being infected by the bacteria. Later, as infection progresses, you may lose your appetite, feel sick and have a tummy ache and diarrhea. Some people may develop a rash. So, what are the symptoms? What are the visible things that happens to a person once he or she is infected by the bacteria? They lose their appetite, feel sick and have tummy ache and diarrhea. Some people may develop a rash. So, these are the things that are seen in a person who is infected by the disease or infected by the bacteria. With treatment, the symptoms of typhoid fever should quickly improve with 3 to 5 days. When the treatment is taken for a typhoid fever, when does the symptoms improve? In 3 to 5 days. If typhoid fever isn't treated, it will usually get worse over a few weeks, and there is a significant risk of life-threatening complications developing. So, if not treated, if left untreated, things can get the symptoms and the disease can get worse, and there is a significant risk of a life-threatening complication. If left untreated, we properly treat this can go worse, and there is a chance of significant risk of life-threatening complications. Without treatment, it can take weeks or even months to fully recover and symptoms can return. If treatment is not taken, it can take, there we said 3 to 5 days in the varno for the disease to, the symptoms of typhoid fever to improve. But if not, if the treatment is not taken, it can take weeks or even months to fully recover. But still the symptoms can return. So it is advised to take proper treatment. So text A, you can see it is an intro to what typhoid fever is, who is mostly affected, what are the symptoms, and how can it be treated, when do the symptoms develop in an infected person. This is text A describe brief. Now let's move on to text B. After eating food or drinking water contaminated with Salmonella typhi bacteria, the bacteria moves down into the digestive system where they'll quickly multiply. So once you eat or drink something which is contaminated by Salmonella typhi, the bacteria moves down to your digestive system. This is where it multiplies. So once you eat the contaminated food or drink something contaminated with the bacteria, that is Salmonella typhi, the bacteria moves down to your digestive system. It is a digestive system where the bacteria multiplies. This triggers a high temperature, stomach pain and constipation or diarrhea. Left untreated, the bacteria can get into the bloodstream and spread to the other areas of the body. So this multiplication that is happening in the digestive system triggers high temperature, stomach pain and constipation or diarrhea. So these are the things that can be seen in a person who is infected by the bacteria. As in, once it multiplies, high temperature, stomach pain, constipation or diarrhea. Left untreated, the bacteria can go into the bloodstream and spread to other areas of the body. Again, if the person who is infected, if the bacteria is left untreated, or you are not taking medicines for the same, it can get into the bloodstream. It multiplies quickly in your digestive system, and if left untreated, the bacteria can get into the bloodstream and spread to other areas of the body. So once it enters into the bloodstream, it can spread to other areas of the body. This can cause the symptoms of typhoid fever to get worse during the weeks after infection. So if left untreated, we said it goes into the bloodstream and travels to other parts of the body. So when it goes into other parts of the body, the symptoms of typhoid fever can get worse during the weeks after infection. If the organs and tissues become damaged because of the infection, it can cause serious complications such as internal bleeding or a section of bowel splitting open. So again, these are the cases when the bacteria is left untreated. The fever can get worse during the weeks after infection. If the organs or tissues become damaged because of the infection, it can cause serious complications such as internal bleeding or a section of bowel splitting open. So examples of complications are internal bleeding or a section of bowel splitting open. Okay, you should see a GP if you think you have typhoid fever, particularly if you have returned from traveling abroad in the past month or so. The GP will want to know if you are traveling to areas where the infection is present, or if you have been in close contact with someone who's traveled to these areas. So if you think you're being infected by the bacteria, or if you have contracted typhoid fever, go see a doctor, that is your GP. And if you have visited or if you have returned from traveling abroad in the past month, or if you visited areas or travel to areas where the infection is present, or if you have been in close contact with someone who has traveled in these areas. So these are the cases in which you can contract typhoid fever. If you think you have contracted the same, go visit your doctor. Typhoid fever is most common in Indian subcontinent, Africa, Southeast Asia and South America. So where are the areas that are places where typhoid fever is very common? Indian subcontinent, Africa, Southeast Asia and South America. So five places where typhoid fever is very common is Indian subcontinent, Africa, Southeast Asia and South America. A diagnosis of typhoid fever can usually be confirmed by analyzing samples of blood, poo or pee. So, how do you diagnose typhoid fever? By confirmed, how do you confirm it? By analyzing the samples of blood, poo or pee. These will be examined under microscope for Salmonella typhi bacteria that can cause the condition. How do you analyze it? These will be examined under a microscope for what? For the Salmonella typhi, the bacteria that can cause the condition. So, test how do you diagnose the disease? Paragraph. The bacteria aren't always detected the first time, so you may need to have a series of tests. Testing a sample of bone marrow is the most accurate way of diagnosing typhoid fever. However, getting the sample is both time consuming and painful, so it is usually only used if other tests are inconclusive. If typhoid fever is confirmed, other members of your household may also need to be tested in the case you have passed the infection on to them. So, the presence of bacteria is not always detected for the first time. So, you may need to undergo a series of tests. Testing a sample of bone marrow. Testing a sample of bone marrow is the more accurate way. The best way to identify whether you have bacteria present in you or not is to take a sample of bone marrow and test it. But this is both time consuming and painful. So, it is usually used if other tests are inconclusive. You cannot get an answer from other tests, then only a sample of bone marrow is being analyzed. If typhoid fever is confirmed, other members of your household may also be tested in case you have passed the infection on to it. So, if you are being diagnosed with typhoid fever, the members of your household should also be tested because you may have passed the infection on to them. Alright, but text B again there. You got what are the tests, endocrine test to confirm the fever, places which are common, places where typhoid fever is common, then symptoms of typhoid fever, then we discussed what are the complications of a typhoid fever if left untreated. So, let's move to the next text C. Okay. Typhoid fever can usually be treated successfully with the course of antibiotic medicine. The infection can usually be treated at home, but you may need to be admitted to the hospital if it's severe. If typhoid fever is diagnosed in the early stages, a course of antibiotic tablets may be prescribed for you. Most people need to take these for 7 to 14 days. Some strains of Salmonella typhi bacteria that cause typhoid fever have developed a resistance to one or more types of antibiotics. Okay. Good evening, Nimi. Yes. So, typhoid fever can usually be treated with successful course of antibiotic. Antibiotics with a number of courses it can be treated. The infection can be usually treated at home, but if the case is severe, you need to be admitted to a hospital. And if the typhoid fever is diagnosed in early stages, it can be treated with the course of antibiotic tablet that is prescribed. You need to take it for around 7 to 14 days, the course of 7 to 14 days. But again, some strains of Salmonella typhi that cause typhoid fever have developed resistant to one or more types of antibiotic. So, this bacteria have become resistant to some types of antibiotics. Hence, you need to be cautious. Yes. This is increasingly becoming a problem with typhoid infections originating in Southeast Asia. Any blood, poo or pee samples taken during your diagnosis will usually be tested in a laboratory to determine which strain you are infected with. So, you can be treated with an appropriate antibiotic. Your symptoms should begin to improve with 2 to 3 days of taking antibiotics. But it is very important you finish the course to ensure the bacteria are completely removed from your body. So, typhoid fever is very increasing. It is increasing in the Southeast Asia. Any blood or poo, any sample that is taken during your diagnosis to test, it is tested in a laboratory to confirm which strain you are being infected with, so that our correct antibiotic can be prescribed for you. So, once you start taking the antibiotics, your symptoms should begin to improve within 2 to 3 days. 2 to 3 days of antibiotics can improve your symptoms. But it's very important you finish the course to ensure that bacteria are completely removed from your body. So once your symptoms improve, you should not stop taking the medicine, but it is important to finish the course so that the entire presence of the bacteria is removed from your body. Make sure you rest, drink plenty of fluids, and eat regular meals. You may find it easier to eat smaller meals more frequently rather than 3 larger meals a day. You should also maintain good standards of personal hygiene, such as regularly washing your hands with soap and warm water to reduce the risk of spreading infection to others. So, make sure you rest. If you are infected, you are undergoing treatment, you are taking a course of antibiotics for typhoid fever, make sure you rest. Drink plenty of fluids. Eat regular meals. Proper food rest വേണം. You may find it easier to eat smaller meals more frequently rather than eating 3 larger meals. 3 നേരം big meal കഴിക്കുന്നേക്കാളും take smaller meals more frequently. So it is much easier for the person. You should also maintain good standards of personal hygiene. Okay, personal hygiene is important and you should maintain a good standard such as regular washing of your hands with soap and warm water. This should reduce the risk of spreading infection to others. So you are infected and there are people in your house. When you maintain a high standard, when you maintain a good standard of personal hygiene, the risk of spreading the infection to others are reduced drastically. Okay, so text C again, that is, we have come to end of text C. Text C how can the typhoid fever be treated? Course of antibiotics എടുക്കണം എങ്ങനെ ടെസ്റ്റ് ചെയ്യാം in how many days do you think there will be an improvement in the symptoms, and what are the necessary things that you should do once you are infected? All right, let's move to the next text, that is text D. In UK, 2 main vaccines are available to prevent typhoid fever. VI vaccine given as a single injection. 𝐀𝐝𝐦𝐢𝐬𝐬𝐢𝐸 vaccine given as 3 capsules to take on alternate days. So in UK it's alone, there are 2 main vaccines available that are there to prevent the fever. That is VI vaccine and 𝐀𝐝𝐦21A vaccine. The VI vaccine is given as a single injection, and 𝐀𝐝𝐦21A vaccine is given as 3 capsules to take on alternate days. So one as a single shot injection and second one as in the form of capsule. Combined typhoid and hepatitis A injections are also available for people aged 15 or over. So there are injections as in vaccination injections for a combined typhoid and hepatitis A, which are given for people aged 15 or over. Protection against hepatitis A lasts 1 year and protection against typhoid lasts 3 years. So combined ആയിട്ട് നമ്മൾ വാക്സിൻ എടുക്കുമ്പോൾ hepatitis A against ആയിട്ടുള്ള vaccine, it lasts for an year, and one that is against typhoid lasts for 3 years. The vaccine works by stimulating your body to create antibodies, and that prevent you from getting ill if you become infected with typhoid bacteria. So how does this vaccine work? It stimulates your body to create antibodies against the bacteria. This will prevent you from getting ill if you become infected with typhoid bacteria. So you're given mild doses of the bacteria so that your body can produce antibodies. If at all you're being infected by the bacteria, these antibodies can protect you from getting a typhoid fever. But neither typhoid vaccine is 100% effective, so you should always take precautions when eating food and drinking water abroad. As the 𝐻𝐲21A vaccine contains live samples of Salmonella typhi bacteria, it isn't suitable for people with weakened immune system, for example, people with HIV and those receiving certain type of treatment such as chemotherapy. It also isn't usually recommended for children under 5, whereas children can have the VI vaccine from 2 years of age. So any vaccine is as in for typhoid, especially for typhoid vaccine, it is not 100% effective. So you should always be precautious when you're eating food or drinking water from abroad. And in the case of 𝐀𝐝𝐦𝐢𝐬𝐬𝐢𝐤 vaccine, it contains live sample of Salmonella typhi, a bacteria live sample under. So it is not suitable for people with weakened immune system. Weak immune system ulla aalkarku ee vaccine kodukkan pattilla. So rather than creating antibodies and preventing that person from getting typhoid fever, they may contract the same. So people with weak immune system are such as people who have HIV and those receiving certain type of treatment such as chemotherapy. And it is usually not recommended for children below 5 years, but whereas children can have VI vaccine from 2 years of age. 2 വയസ്സിന് മുകളിലുള്ള ആൾക്കാർക്ക് VI vaccine എടുക്കാം. പക്ഷേ below 5, children aged below 5, they are not usually recommending the vaccine 𝐡𝐴21A, because it contains a live sample of Salmonella typhi. It is unclear whether the VI and 𝐡𝐴21A vaccines present a risk to pregnant or breastfeeding women. The vaccination should be considered if there is a significant risk of getting typhoid fever. Typhoid vaccine should ideally be given at least 1 month before you travel, although if necessary, it can be given closer to your travel date. Booster vaccinations are recommended every 3 years if you continue to be at risk of infection with typhoid bacteria. So both the vaccines, that is VI and 𝐡𝐴21A, it is very unclear whether they pose a risk for pregnant women or breastfeeding mothers. But the vaccination should be considered if there is a significant risk of getting typhoid fever. And this vaccine is usually given a month ahead of traveling. But in cases where is given closer to your travel date, if it is necessary, if there is a necessity, it is given to dates that are closer to travel. Again, booster vaccinations are recommended. Booster vaccinations are recommended every 3 years if you continue to be at risk of infection with typhoid bacteria. You are under continuous risk of this bacteria. Booster vaccinations are always recommended every 3 years. കാരണം നമ്മൾ നേരത്തെ പറഞ്ഞു 𝐡𝐴21 vaccine can prevent അല്ലെങ്കിൽ and the protection can last for 3 years. So booster vaccines is recommended once every 3 years. After having the typhoid fever vaccine, some people have temporary soreness and swelling at the injection site. So there are the cases of temporary soreness and swelling at injection site if after having the typhoid fever vaccine. For certain people, about 1 in every 100 people have high temperature, and less common side effects are abdominal pain and headache. So 1 in every 20 people get temperature, but the less common side effects are abdominal pain and headache. So ഇതൊക്കെയാണ് what are the preventive measures ആണ് ടെക്സ്റ്റ് ഡിയിൽ പറയുന്നത്. Preventive measures as in what are the vaccine, how long does the protection of the vaccine last, and who can be given, who cannot be given, and what are the difference of the both. All right, and there is one more one. Affected people with the age group in 10 years. So you can see a graph, and there is years, as in 2004 തുടങ്ങി 2014 വരെ പറഞ്ഞിട്ടുണ്ട്, and there is a number given as well. So less than 5 years, 14 years, 15 to 44 years, 45 to 64 years, and 65 and over. So there is a graph that represents about number of people being affected each year. Okay. All right. So we have come to the end of part A. Okay. 4 text la endha parna, we got an introduction in text A, then we got the symptoms that are usually there and what should we do if we contract the fever, and then in text C we saw what can be done, what are the medicines that can be taken, what are to be taken once you are being contracted. Then there is text D where we spoke about the vaccine as well as the number of people being affected by the same. So now let's move to the questions. So let's answer the 20 questions. So let's see the initial section, that is questions 1 to 7. I hope you guys got a brief overlook of the material part A of typhoid fever. Now let's move to the questions. Questions 1 to 7. For each question 1 to 7, decide which text A, B, C or D the information comes from. You may use any letter more than once in which text you can find information about. So let's see in which text can we find. First question. Who is mostly affected by typhoid fever? I'm repeating. Who is mostly affected by typhoid fever? In which text did we discuss the same? Can you comment? Yes. In which text did we discuss that and to for who are mostly prone to this and who develop most symptoms? So answer to this is text A. Text A ലാണ് നമ്മൾ പറഞ്ഞത്. Text A we discussed regarding എന്തൊക്കെയാണ് symptoms വരാ, ആരൊക്കെയാണ് mostly affected. Okay. So answer to question number 1 is A. Second one, how can the typhoid fever be diagnosed? How can the typhoid fever be diagnosed? Yes, Nimi, question 1, the answer is text A. Question 2, how can the typhoid fever be diagnosed? Where did we talk about the diagnosis? എങ്ങനെയാണ് കണ്ടുപിടിക്കാന്നൊക്കെ നമ്മൾ ഏത് ടെക്സ്റ്റിലാണ് പറഞ്ഞത്? യെസ്, ടെക്സ്റ്റ് ബിയിലാണ് നമ്മൾ പറഞ്ഞത്. ടെക്സ്റ്റ് ബിയിൽ yes, typhoid fever is very common. How can we diagnose? Last paragraph നോക്കിയേ, bacteria always detected first time. അല്ലെങ്കിൽ second last paragraph, these will be examined under microscope for salmonella typhi bacteria that can cause the condition. Then we spoke about the testing of bone marrow for accurate diagnosing. Okay, so answer to the second question is B. Moving on to third, how will the vaccines of thyroid fever work? Sorry. How will the vaccines of typhoid fever work? Small error, that is typhoid fever. Okay. How will it work? In which text did we discuss? Last text we spoke about the two vaccines, that is VI vaccine and TY21A vaccine. So text text sorry. Text D ലാണ് നമ്മൾ ഡിസ്കസ് ചെയ്ത. യെസ് നിമി, the answer to question number 3 is D. How will the vaccine work എന്നുള്ളത് പറഞ്ഞത് ടെക്സ്റ്റ് ഡിയിലായിരുന്നു. In which year do the least number of cases reported under the age of 15? In which year do the least number of cases reported under the age of 5? We discussed a tabular column. The answer is D. Can typhoid fever be treated successfully? Can it be treated? Where did we see about the treatment schemes and your symptoms should begin to improve within 2 to 3 days of taking antibiotics. Then, you can be treated with appropriate antibiotics. So, the disease can be treated successfully. So, answer to this question is C. How the typhoid infections can happen in the body? How can this present in the body? How does the typhoid infection happen in the body? Again, We spoke about the treatments, we spoke about the medicines. Correct ആയിട്ട് എടുക്കുവാണെങ്കിൽ എങ്ങനെയായിരിക്കും? How can you diagnose? In which text did we discuss that? Text B ലാണ്. Let's see. Text B. Yes. After eating food or drinking water that is contaminated with Salmonella typhi, the bacteria moves down into the digestive system where they will quickly multiply. So what happens nullana adu? Again, the symptoms can get worse. Anganengil, if the organs and tissues become damaged, what can happen? There can be internal bleeding and section of the ball splitting open. So there is complications, and what can happen if you ingest the bacteria. അതേതായിരുന്നു? ടെക്സ്റ്റ് ബിയിലാണ് അത് വരുന്നത്. സോ ആൻസർ ടു ക്വസ്റ്റ്യൻ നമ്പർ 6 ഇസ് ബി. Okay, moving on to question number 7. Why is typhoid fever common in this part of the world? Repeating. Why is typhoid fever common in this part of the world? We spoke about 4 different areas. Indian subcontinent, Southeast Asia, Africa. ഏതിലായിരുന്നു? In which text did we discuss that? Discuss that in text A. Text A യിൽ പറഞ്ഞായിരുന്നു. ടെക്സ്റ്റ് എയിൽ വരുന്നുണ്ട്. Why the typhoid fever is common in this part of the world? എന്തായിരുന്നു? Poor sanitation and limited access to clean water. ആ രണ്ട് കേസുള്ള പാർട്സ്. Poor sanitation and limited access to clean water. ബിയിൽ നമ്മൾ 4 places പറഞ്ഞു. ടെക്സ്റ്റ് എയിൽ we discussed 4 parts of the world. In text A, we mentioned common parts of the world where poor sanitation and limited access to clean water. അങ്ങനെയുള്ള കേസിലാണ്. It is very common. So then answer to question number 7 is A. Okay, so I hope you got the answers to all the questions 1 to 7. Let's move to next section. Answer to questions 8 to 40 with a word or a short phrase from the text. Each answer may include number or both. Okay, let's see question number 8. Which samples are generally tested and analyzed for diagnosis of typhoid fever? I'm repeating. Which samples are generally tested and analyzed for the diagnosis of typhoid fever? എന്തിൻ്റെ സാമ്പിൾ എടുക്കുന്നത്? What sample of your body is taken to diagnose the disease or get tested? Any common answer? We discussed that in text C. Text C യിൽ നമ്മൾ പറഞ്ഞായിരുന്നു. What are being tested? And in initial test inconclusive ആണെങ്കിൽ again which other part of your body is being tested? Text C യിൽ നമ്മളത് ഡിസ്കസ് ചെയ്തായിരുന്നു. So answer to question number 8 is blood, poo and pee. ഈ 3 സാമ്പിൾ എടുത്തിട്ടാണ് ഡയഗ്നോസ് ചെയ്യുന്നത്. യെസ് നിമി, ബ്ലഡ്, പൂ ഓർ പി. How long should the symptoms of typhoid fever improve with treatment? I'm repeating. How long should the symptoms of typhoid fever improve with treatment? We discussed that in which case? നമ്മൾ ടെക്സ്റ്റ് എ ഒന്ന് എടുത്ത് നോക്കാം. ടെക്സ്റ്റ് എ എടുത്ത് നോക്കാം. Yes. Text in the last paragraph. Okay. With treatment, the symptoms of typhoid fever should quickly improve within 3 to 5 days. Yes. 3 to 5 days ആണ് improvement. Significant improvement varan symptoms with treatment. So answer to question number 9 is 3 to 5 days. Yes, Beena. Question number 8 in the answer ആണ് blood, poo or pee. We have moved on to question number 9. For that, the answer is 3 to 5 days. 3 to 5 days. Now let's move on to question number 10. Which vaccine is given in a capsule form to prevent typhoid fever? I'm repeating. Which vaccine is given in a capsule form to prevent typhoid fever? Yes, Beena. 9th question answer 3 to 5 days. Let's answer question number 10. Which vaccine is given in a capsule form to prevent typhoid fever? So, text D, we discussed two vaccines, VI vaccine and TY21A vaccine. And we also discussed that VI vaccine or a single injection item, TY21A vaccine or 3 capsules which is to be taken on alternate days. Yes, answer to question number 10 is TY21A. TY21A ആണ് 10th question answer. Yes, Nimi, TY21A is the answer. Yes, Bina, TY21A ആണ് answer. Let's move on to question number 11. Where will the Salmonella typhi bacteria quickly multiply? Repeating, where will Salmonella typhi bacteria quickly multiply? We discussed that in text B. Text B il nammal paranju evideyanu pettennu multiply cheya ennu paranju. Again, we had a similar question in section A. What happens to typhoid? How does the infection spread across the body? Ennulla discuss chedu. So, where will Salmonella typhi bacteria quickly multiply? Yes, into the digestive system. Text B edukam. Text B eduthu nokke. Yes, after eating food or drinking water that is contaminated, the bacteria will move down into your digestive system where they will quickly multiply. But digestive system tilana avar quick aayit multiply avana in the Salmonella typhi bacteria. Yes, has been a digestive system aana. Question number 12. In which year was the highest rate of typhoid fever reported in over the age of 65? I'm repeating. In which year was the highest rate of typhoid fever reported in over the age of 65? A tabular column eduthu okay. Tabular column 65 എന്ന് പറയുന്നത്, യെസ്, ദ ഗ്രേ വൺ. ഗ്രേ വൺ ഏറ്റവും ഹൈ ആയിരിക്കുന്ന ഏത് കേസിലാണ്? യെസ്, 2011. സോ 2011ലാണ് നമുക്ക് ഏറ്റവും ഹയസ്റ്റ് കാണുന്നത്. യെസ്, 2011ലാണ് വരുന്നത്. So, in which year was the highest rate of typhoid fever reported? The answer is 2011. Moving on to question number 13. Yes, Nimi, 2011 ആണ് answer വരുന്നത്. What is the time duration for booster vaccine if you are at continued risk of typhoid fever? We spoke that there is a combined vaccinated protection for typhoid fever as well as hepatitis A, where the protection against hepatitis A lasts for a year and for typhoid fever lasts for 3 years. So, booster vaccination avada parnu once every 3 years ennu parnu. So, we said that in text D. Once every 3 years. Booster vaccines tharanam is recommended for people who are at continued risk ennu parayunnu. Booster vaccinations are recommended every 3 years. So, answer to question number 13 is 3. Yes, Nimi has been a 3 years aanu answer varunnu. 14 question. What are the less common side effects of typhoid vaccine? I'm repeating. What are the less common side effects of typhoid vaccine? Eighth text la irunnu parnathu where we spoke about the typhoid vaccines and everything. Text D le parnayirunnu abdominal pain and headaches. Less common side effects of the vaccine പറയുന്നത് ടെക്സ്റ്റ് ഡിയിൽ ലാസ്റ്റ് പാരഗ്രാഫ് വരുന്നുണ്ട്. യെസ്, സോ ലെസ് കോമൺ സൈഡ് എഫക്ട്സ് ഓഫ് ടൈഫോയിഡ് വാക്സിൻ ഇസ് അബ്ഡോമിനൽ പെയിൻ ആൻഡ് ഹെഡേക്ക്. യെസ്, നിമി 14th question ആൻസർ വരുന്നത് അബ്ഡോമിനൽ പെയിൻ ആൻഡ് ഹെഡേക്ക് ആണ്. So I hope you guys got questions 8 to 14 and you were all able to answer that. Let's move to the last section, that is questions 15 to 20. Yes. Questions 15 to 20, complete each of the sentences 15 to 20 with a word or short phrase from one of the text. Each answer may include words, number or both. So let's see question number 15. The symptoms of typhoid fever generally develop dash after becoming infected with the bacteria. I'm repeating. The symptoms of typhoid fever generally develop dash after becoming infected with bacteria. എവിടെയായിരിക്കും? ഡിസ്കസ് ദാറ്റ് ഇൻ ടെക്സ്റ്റ് എ. ടെക്സ്റ്റ് എയിൽ നമ്മൾ ഡിസ്കസ് ചെയ്തായിരുന്നു. എപ്പോഴായിരിക്കും ഡെവലപ്പ് ആവാമെന്ന് പറഞ്ഞത്? How long does your body take to develop the symptoms once contracted with the disease? Yes. Symptoms of typhoid fever. Text A എടുത്ത് നോക്കാം. Symptoms of typhoid fever usually develop 1 to 2 weeks. 1 to 2 weeks after a person becomes infected with the bacteria. So answer to question number 15 is 1 to 2 weeks. Yes. Let's move on to question number 16. Yes, Nimi, 1 to 2 weeks and answer. Let's move to question number 16. Testing a sample of dash is the most accurate way of diagnosing typhoid fever. I'm repeating. Testing a sample of dash is the most accurate way of diagnosing typhoid fever. Again, text B we discuss text B discuss what is tested. What is tested? Can you comment? Yes. Text B the last paragraph. Testing a sample of bone marrow is more accurate way of diagnosing typhoid fever. So question 2. Answer to question number 16 is bone marrow. Yes. Yes, Nimi, bone marrow on question number 16 answer. Now let's move to question number 17. Combined dash and dash also available for people aged 15 or more. Repeating, combined dash and dash are also available for people aged 15 or more. We discussed that in text D. Text D we discuss it. Yes, combined typhoid and hepatitis A vaccines are also available for people aged 15 or more. Text D eduthu noka. Yes. First bullet points nu thottu thare. Combined typhoid and hepatitis A injections are also available for people aged 15 or more. So answer to question number 17 is typhoid and hepatitis A injection. Yes. Typhoid and hepatitis A injections. Let's move to question number 18. After having the dash, some people have temporary soreness and swelling at the injection site. Repeating. After having the dash, some people have temporary soreness and swelling at the injection site. Where did we discuss that? In which text would it be? Yes. Either text ആയിരിക്കും. What would be the answer to question number 18? After having the dash, some people have temporary soreness and swelling at the injection site. Text D eduthu nokka. Text D il last paragraph edukka. After having the typhoid fever vaccine, some people have temporary soreness and swelling at the injection site. So answer to question number 18 is the typhoid fever vaccine. Yes, after having the typhoid fever vaccine, some people have temporary soreness and swelling at the injection site. Let's move on to question number 19. Yes, Nimi, question number 18 answer typhoid fever vaccine. Let's move to question number 19. Children with typhoid fever tend to have the dash than adults. Question number 19. Children with typhoid fever tend to have dash than adults. In which text did we talk about the children? Text A text A we spoke about children. Yes, we spoke about worldwide children are thought to be at more risk. But this may be because their immune system is still developing. And adutha line okay, children with typhoid fever tend to have milder symptoms than adults. Children with typhoid fever tend to have milder symptoms than adults. So answer എന്തായിരിക്കും question number 19 milder symptoms. Yes. So children with typhoid fever tend to have milder symptoms than adults. Now let's get to the last question. Question number 20. Some strains of Salmonella typhi, bacteria that cause typhoid fever, developed dash to one or more types of antibiotics. I'm repeating. Some strains of Salmonella typhi bacteria that can cause typhoid fever developed dash to one or more types of antibiotics. We discussed that in ഏത് ടെക്സ്റ്റിലായിരുന്നു നമ്മൾ പറഞ്ഞത്? ടെക്സ്റ്റ് ബിയിൽ പറഞ്ഞായിരുന്നു. ആൻറ്റിബയോട്ടിക്സിൻ്റെ കാര്യം, ആൻറ്റിബോഡീസിൻ്റെ കാര്യമൊക്കെ പറഞ്ഞായിരുന്നു. ഓക്കെ, we spoke about text Cയിലും we spoke about the same. Okay, so let's take what happens if it develops dash to one or more types of antibiotics എന്ന് പറഞ്ഞായിരുന്നു. It develops resistance. Yes, Nimi, answer is resistance. Some strains of Salmonella typhi bacteria that can cause typhoid fever developed resistance to one or more types of antibiotics. So we have come to the end of the questions of part A. I hope you guys were able to understand and were able to answer the questions. Yes. Thank you and have a good night.